Let's talk about managing hypertension that is specifically manifesting because of sepsis on the wards. So, what do you need to assess when it comes to your patients? You need to have a look at their observations, what signs they're demonstrating physically, and any investigations that you've done. Lactate is very important, and you can get that from an ABG or a VBG. Lactate less than 2 shows that it's mild. Lactate between 2 to 4 means moderate disease, and lactate more than 4 means severe. Which observations would be red flags? So mental status changes, respiratory rate being more than 20 or a new oxygen requirement, heart rate being more than 90 would be moderate, but more than 130 would be a severe sign of sepsis. Systolic blood pressure being less than 90 would be again a severe sign of sepsis, and urine output being less than 0.5 mils per kilogram per hour would be another sign of sepsis. End organ dysfunction sepsis. So how are we looking for end organ dysfunction? Respiratory wise, there might be poor oxygenation of the patient's lungs, they're hypoxic, fast respiratory rate, new chest x-ray findings. Cardiovascularly, a systolic blood pressure less than 90, that might be a sign of sepsis. Kidney dysfunction would be urine output being less than 0.5 mils per kilogram per hour, or a creatinine rise more than 50% of the baseline. Liver, bilirubin more than 35 micromoles or ALT twice as high as normal, and neuro having new confusion. How do we manage sepsis? You give 3, you take 3, you give IV fluids, give oxygen, give antibiotics, take blood cultures, lactate, and hemoglobin. Hemoglobin is also important in case